1953. Polio is America's most feared disease. Every summer it paralyzes thousands of children. Parents won't let their kids go to pools, movie theaters, anywhere crowds gather. One scientist believes he has the cure. But before he can test it on anyone else, he injects it into himself, his wife, and his 3 young sons. If he's wrong, he could give his entire family the very disease he's trying to prevent. In the early 1950s, polio was every parent's nightmare. The virus attacked the nervous system, leaving children paralyzed. In 1952 alone, nearly 58,000 Americans contracted polio. Over 3,000 died. Thousands more ended up in iron lungs. Even President Franklin Roosevelt had been paralyzed by it. The March of Dimes raised millions for research. Everyone wanted a cure. Enter Jonas Salk, a 38-year-old researcher at the University of Pittsburgh. He'd been working on an unconventional approach. Most researchers were trying to develop a live, weakened virus vaccine. Salk went the opposite direction. He wanted to use a killed virus. The idea: inject dead poliovirus into the body. The immune system would learn to recognize it and build defenses. The problem? Many scientists didn't think it would work, and it had never been tested on humans. By early 1952, Salk had tested his vaccine on monkeys. It worked, but monkeys aren't people. He needed human trials. Jonas Salk had 3 sons: Peter, Daryl, and Jonathan, and he made a decision that would shock the medical community. In July 1952, without any formal approval, without any oversight committee, Salk brought his vaccine home. He injected himself first, then his wife Donna, then one by one, his 3 young sons. He was betting his family's lives on his science. If Salk had made a mistake, he could have given his children polio. They could have ended up paralyzed or dead. For weeks, Salk monitored his family obsessively, taking blood samples, checking for any signs of illness, waiting to see if they'd develop antibodies or symptoms. The results were everything Salk hoped for. His family developed strong antibodies against polio. No one got sick. Emboldened by his family's safety, Salk shared his results. But the medical establishment was horrified. Today, what Salk did would be considered completely unethical. You can't experiment on your own children. But Salk argued he'd proven something crucial. He believed in his vaccine so completely that he'd risked his own children's lives. In 1954, the largest medical trial in history began. 1.8 million children, called polio pioneers, received the vaccine. The nation held its breath for a year. April 12, 1955. The results were announced. The Salk vaccine was safe and effective. 80–90% protection against polio. The news triggered celebrations across America. Church bells rang. People wept in the streets. Salk became an instant hero. When asked who owned the patent, Salk famously said, "Well, the people, I would say. There is no patent. Could you patent the sun?" Within years, polio cases in the U.S. dropped by 90%. By the 1960s, the disease was essentially eliminated in America. Today, thanks to global vaccination efforts, polio has been eradicated from most of the world. Salk's self-experimentation worked, but it set a dangerous precedent. We have ethical guidelines for a reason. In the 1960s, he helped establish the Salk Institute with strict research ethics protocols. His 3 sons, the boys he vaccinated, all grew up healthy. They became a physician, a psychiatrist, and a poet. His willingness to use it on his own family convinced millions of parents it was safe. Jonas Salk never profited from his vaccine. He spent the rest of his life seeking cures for cancer and AIDS. He died in 1995, having saved millions of lives. The Salk vaccine has prevented an estimated 20 million cases of paralysis worldwide, all because one scientist was willing to bet everything. It was unethical, it was dangerous, and it changed the world. Dr. Jonas Salk, 1914 to 1995. Vaccinated himself, his wife, and his 3 sons in the summer of 1952. Polio cases dropped by 90% within 2 years. He never patented the vaccine, giving it freely to the world. Its estimated value, over $7 billion. Next episode, the anesthesia doctor's awakening. A pioneering anesthesiologist experiences the nightmare of being awake during his own surgery.